Hi everyone, this is our first online session. I hope it works well. In today's session, we are going to focus on taking history. The aim of this unit is to ask questions to get information about the patient's condition, to write a case note using the dialogues and videos, and to write a referral letter using the case notes and dialogues. That's what we're going to do in this session. Okay, let's get started with asking about the problem. How can we ask questions, in other words? Why do you think asking questions is crucial? In other words, asking questions is very important. What do you think? Think about it for a few minutes and then move on. The answer is quite simple. Asking questions provides information to doctors and healthcare providers, and it builds trust and leads to better results, naturally. What kind of questions can you ask? Okay, to go through their symptoms, we need to ask WH questions like what, when, where, why, or how. For example, you can ask what happened, where is the pain, or what is it like, or how they have changed in the last days or weeks, things like that. Also, you can ask them about their medical history. It's a good chance to build up a detailed picture about past illnesses, accidents, maybe surgeries, hospitalizations, and so on. You also need to find out about patients' background. That is, finding out if there are genetic conditions in the family or not. Another important question is to ask about allergies as well as reactions to medications, for example, penicillin, let's say. Habits are also important, so habits play an important role in asking questions. You need to know if the patient smokes or drinks alcohol or uses illicit drugs, or you need to learn about his or her eating or drinking habits. So these are some sort of necessary questions to be asked during questioning the patient. And the most important thing is, while asking questions to the patient, you need to take notes. Why do we need to take notes? Because if you don't take notes, you won't be able to remember every single detail. But if you take notes, at the end of your conversation, you can just look at your notes and you can give a brief summary of your notes, and then the patient confirms your notes if it's accurate or not. So it gives you a chance to check your notes before you start examining and treating the patient. Here we have a case note. James Robert is a 48-year-old single patient. He's a builder, and let's look at his complaints or problems. It says CO frontal headache 4/7. Well, what does that mean? CO means complaint of. 4/7 means 4 times a week. So the full sentence, the actual sentence is, I have a frontal headache 4 times a week. You don't need to write every single word, or you can't write every single word while listening. So we need to take notes, and while taking notes we need to use some abbreviations. In other words, we use some short forms to make our lives easy. Okay, look at the symptoms now. We have three major symptoms. It says worse at nights when bending down. What about the actual sentence? Whenever I bend down or at nights, it gets worse. The second symptom says ringing in the ears and dizziness. So again, the original sentence might be I have ringing in the ears and I feel dizzy, kind of, but you don't need to write that sentence again. Okay, as you see, none of them are full sentences, so they use short forms or short expressions, and afterwards when you look at your notes you can remember the entire text. Can you ask 3 questions for the first line? CO frontal headache 4/7. What can we ask for this line? Okay, first you can ask a general question. For example, what brings you here? What seems to be the problem? What's the matter with you? Kind of questions. Second, you can ask where exactly is the pain. Third, you can ask how often do you get it? How often do you get this pain? Again, we have some prompts. Can we make questions now using the prompts? Okay, the first question is what are your symptoms? 2, does anything make it worse? 3, does anything make it better? 4, when does it get worse? And 5, do you have sleeping problems? These are the questions. Okay, now we are going to write a referral letter together. But before we start writing, let's try to remember what we have learned about a referral letter. What was it? What is it? Referral letter is written by GPs. In other words, general practitioners, right? They write referral letters to other specialists. They list health problems experienced by the patient. They include, referral letters include symptoms, medical conditions, events such as trauma, investigation results, or response or lack of response to treatment. It also includes onset, when did it start, and duration, how long did it last, for example, or how long has it lasted, or the severity of the event. Is it severe or serious or a mild case? It depends. So when we write a referral letter, we need to put these items into this letter. So far we have worked on question forms and we used Robert James. Now it's time to write a short referral letter together. Can you use the information given on Robert James' card and write a short referral letter? Please try to do it first, and when you finalize it, I want you to compare yours with mine. But do not quickly move on to the next part of this video. Here is a referral letter. Please read it and compare with yours. Now it's your turn to look at the doctor's notes and ask possible questions. This time, you are going to ask questions about Liz Horner. Okay, here we have some question prompts to be asked on the left and some complaints or symptoms on the right. Let me give you an example. Physiotherapist asks, what seems to be the problem? And the neurologist answers, he has the pain in his right leg and in his back. Now it's time to write a dialogue using all these prompts. After you have finished your dialogue, you can check your answers, okay? Okay, as an assignment you will write another referral letter, but this time you're going to send it to me. And the necessary information is given on your worksheet, and I send it to you as well. Okay, now you're going to watch a short film about taking the clinical history. While watching, try to answer the questions. Okay, as a post activity, we have a writing task. Here, please watch the last part of the video. You will see the nurse practitioner sums up the patient's condition before examining him. Please try to take notes while watching. Look at part B and C on your worksheets, and then write about patient's complaints and medical history as a short paragraph.
Come on in and have a seat.
Thank you.
Okay. Hi, my name is Gemma Hurley. I'm a nurse practitioner. And you are?
Paul Collins.
Okay, Mr. Collins, how would you like me to call you?
Oh, Paul's fine.
Is that okay? All right. Well, for me to be able to help you today, I need to take a history, which will involve me asking you questions about your health and also about your social circumstances. Is that okay with you?
That's fine.
Okay. Before we start, I just wanted to confirm your details. So it's Paul Collins, and you're 46 years old. And is this your address?
That's right.
Perfect. Great. Okay. Excellent. So, how can I help you today?
Well, I've had a cough for a few days. It's just driving me nuts, really.
Right. How long has the cough been there for?
I suppose about 3 or 4 days now.
Has it? And have you got any other symptoms with that cough?
I've got quite a sore throat. That's quite bad as well.
Right. And a sore throat, has it been there the same amount of time?
Yes.
What makes a cough and sore throat better for you? Is there any relieving factors?
Well, the cough, nothing really. I've tried over-the-counter sort of stuff from the chemist and that didn't work.
It didn't help.
The throat, if I have a warm drink, that helps.
Okay, okay. Anything make it worse at all, this cough?
No, not really.
Nothing at all. Okay. What do you think it is?
I don't know. I just think I need some antibiotics.
Right,
to get rid of it.
Okay. I just want to ask you more specific questions now. You said there's no blood in the phlegm, but is there any fever, any feeling shivery?
First day I was ill, I was a bit shaky like that, but now I'm not.
Okay. And what about breathlessness? Have you got any breathing problem or chest tightness?
No.
Okay. I just want to go through some of your key sort of body systems, Paul, just to find out about your overall health. Can you tell me about, do you suffer with headaches at all?
Sometimes I get headaches.
Do you? Okay. How often do you get headaches?
Once every month, something like that.
Is it? And have you seen your doctor for that?
No, I just take some painkillers and they go away.
They go away. Okay. Have you ever had any head injuries?
No.
Okay, good. Okay. And what about your vision? Do you wear glasses?
No, no.
Okay, vision's good?
Yeah.
Okay. Do you ever suffer with nasal congestion or sinus problems?
The only time I do is with cats, really. They set me off.
Right. Are you allergic to cats?
I think I must be.
Oh, shame. Okay. What about your tastes? Any change in taste?
No.
Okay.
No.
Do you get mouth ulcers at all?
Sometimes I do.
Do you? Okay.
If I'm busy at work or something.
Right.
Sometimes I get mouth ulcers.
Okay. And you have a sore throat now, but do you get recurrent sore throats or?
No, I've never.
You don't?
Years.
Good, good. And any sort of problems with your chest in terms of heart problems, breathing problems?
No,
Okay.
nothing like that.
Okay. And your bowels working all right?
They're fine.
Good. Water works okay? Excellent. I hope you don't mind, but could I just ask a little bit about your sexual history? Are you in a relationship?
Yeah.
Okay. Are you heterosexual or gay?
Yeah.
Okay. And contraception, do you use barrier
Well,
methods?
my girlfriend's on the pill.
Okay, and it's a long-term relationship,
Yes,
is it?
yes.
Okay. A little bit about your surgical in the past. Have you ever had any operations?
I had an operation, must be 20 years ago, some sort of operation on my back.
Ah, right. Okay, okay. And has it been all right since then?
Yeah, no problems
Okay.
at all.
And no other operations?
No, nothing.
Okay. I'm just going to list off, just to probe your mind a bit, in terms of medical history. Have you or any of your first-degree relatives, so mum, dad, siblings, ever suffered with any jaundice where you've seen yourself go yellow? Or,
No.
okay. Any anemia at all? Iron
no,
deficiency?
no.
Good. Okay. Have you ever had a heart attack or any member of your family?
No.
Okay. What about TB? Anybody with TB or you've been
No,
to?
not as far as I know.
Good. Any thyroid problems?
No.
Okay. Any rheumatic fever or rheumatoid arthritis? Good. Okay. Any heart problems?
No.
Okay. Any high blood pressure?
Well, I've got high blood pressure.
Oh, you have? Okay. And when was that diagnosed?
I was diagnosed, 2 years ago now.
Was it? And is it well controlled?
Well, I think so.
Okay. And what about diabetes? Do you have any diabetes or your family?
Yes.
Oh, you do?
Yes, I'm diabetic.
Right. And do you know what type?
It's the one with the tablets.
Okay, so you take tablets.
I
do. Okay. When were you diagnosed with diabetes?
That was about 3 years ago now.
Okay, perfect. Any asthma at all?
No.
Okay.
No.
Any strokes? You had any mini sort of numbness or family members?
Oh, my dad, he died 2 years ago of a stroke.
Okay. How old was he?
He was 72.
72. Okay. And any cancers in the family or you've been?
No.
Okay, good. Okay, brilliant. I just want to move you along a bit further. Do you take any prescribed medicines? I know you've got diabetes and high blood pressure.
I do. I take Ramipril.
Okay.
And I take metformin, and there's another one that begins with G for the diabetes.
So glycoside. Excellent. Okay. And what about allergies? Are you allergic to anything? And any foods like nut allergy or anything like that?
No.
I just want to sum up, Paul, if you don't mind. Please correct me if I've got any of it wrong. You've had this cough and sore throat for the last 3 days. It's sort of, nothing makes it really better, although you have taken the paracetamol. That's helped a little bit. You've not had any blood in that phlegm, no fever, no unexplained weight loss. Breathing's okay as well. You've got type 2 diabetes because you take tablets for that and it's well controlled, and so is your blood pressure. Your dad died sadly of a stroke. Okay. Is there anything else you want to add to that before we move on?
No, that's it, I think.
All right, okay. Well, what we need to do now is to check some vital signs, and I need to examine you before we could decide, what's going on with your sore throat and cough, and take it from there. Is that okay with you?
That's fine.
Good, thank you.
This is the end of our session. If you have any further questions, please send me an email and I can answer it as soon as possible. Thank you for participating in this lesson.